Welcome to Living Energy Day, and I'm here with Dr. Glen, or Dr. Glen Swartwout as he's known, but mostly called Dr. Glen, who's an amazing guy I met a year or two ago by chance, sort of, in another type of meeting, and was just fascinated by his wealth of knowledge he brings from his background as a Doctor of Optometry to all the stuff he's done with that and since that, and so I'm going to introduce you to Glen. Glen, how are you today?
Doing great. Aloha from Hawaii.
Yeah, he's out in the nice, the Big Island, right?
That's right. Hilo.
Hilo, okay. Yeah. Really nice. Well, what I wanted to start out with is, let's talk a little bit, because I was fascinated by what you talked about with the eyes and being a doctor of optometrist. Maybe you could start with that and talk about what you learned there and how you then moved beyond that into some other things. So give us a little background on your work as an optometrist.
Yeah, I grew up in a family that was oriented to natural medicine. So to me, that's always been normal: energy medicine, natural medicine. My dad was an optometrist, specializing in vision therapy and rehabilitation, like of head trauma or prevention and eye exercises and nutrition. That was all, normal approach for him. And so I knew that I could go into the healing field and do the kind of work that he was doing and have some freedom to do some work in nutrition and natural medicine, which was always my interest as well. So when I got out of school, I started exploring, because in school they just taught us things like cataracts and glaucoma. There's there's maybe drug treatment for glaucoma, surgical treatment for cataract and glaucoma, but there was no sense of being able to prevent or reverse eye diseases with natural means. And having grown up with the orientation that that's what we need to do to keep ourselves healthy, I just started looking at the literature, drawing together whatever references I could on nutritional factors, herbal remedies, homeopathy, color and light therapy, other frequency therapies, and seeing what would help. And even the first thing that we did with cataract, which is the most common surgical procedure in America and Medicare. Most people, if we live long enough, will wind up going through cataract surgery. And who wants to have our eyes cut open? And it's just the surgery itself is not something that anyone would look forward to. And plus, the surgery doesn't remove the cause. The cause is not age. Age is time. Time doesn't cause. There's other specific causes within that context, whether it's free radicals, heavy metals, lack of circulation, and poor nutrition, reduced ability to digest and absorb nutrients, and utilization in the cells. All these things are key factors. And so if there was just one cause, then that would be easier for our Western medical scientific approach that dominates to isolate that one cause. But because it's multifactorial, like most of our complex chronic health issues, we have to address it at all the different levels: at nutritional levels, at detoxification levels, circulation, movement and activity and intention, the power of the mind and the immune system, with the mind behind it to heal ourselves. So I did a little study with just the regular patients coming through the practice who were beginning to show signs of cataract. And we found that within 1 month of just some general guidance on some of the risk factors that we were aware of 30 years ago, that most of those people could actually show some beginnings of improvement in the health of the lens, the clarity of the lens, the visual acuity, and factors that showed there was improved neurological health of the visual system as well. So, and we've certainly come a long way since then. There's all the time new therapies and more research coming, from Europe, from all around the world. And that's my point of view as an eye doctor, is the eyes don't heal themselves and they don't get sick on their own either. We have to look at ourselves as a whole person, look at our lifestyle. What are we feeding those eyes? And what are we doing with them? Activity and the use of consciousness is critically important in healing vision and keeping our vision going. When people are surveyed, about, what would you least like to lose of all your functions and abilities, usually vision comes up number one. As human beings, vision is our dominant sense. Just like dogs are very, very smell oriented, we're very visually oriented. And, when you start losing your vision, you really realize that.
Yeah, and I thought it's interesting when, because I'm nearsighted and I have been since I was a teenager at least, or maybe even younger. And, but it really wasn't until I looked into some of the holistic ways of trying to improve that I realized, well, your eye is very fluid and flexible. It shouldn't elongate or become too short. It's really the muscles and the other things that kind of, right? How does that work as far as nearsighted and farsighted?
Nearsightedness is very interesting. My first practice was a research practice in Tokyo, Japan. And looking back at their history, 100 years before I was there was less than 2% myopia or nearsightedness in Japan. And that went up, 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 really starting in the 1890s when they started polishing the rice. So refined foods is a critical factor, sugar and refined carbohydrates. And, we're seeing with all of the health woes, how important a factor that is, that we need whole foods. We need the micronutrients and trace elements that are in those whole foods, not to fractionate them and just get the bulk calories. Calories is not, counting calories is not the way to health. And the things that we miss, the first thing that we lose in refining foods, in grains like rice, is chromium. It's the one mineral that we need, that our kidneys that retain minerals from the urine have no mechanism to retain. So it's the first thing that we lose in refining the foods, the first thing we lose from the body. It's critical for sugar regulation. It's critical for maintaining health of the cardiovascular system. And of course, the retina of the eye is the highest oxygen demanding tissue in the whole body. So it really needs quality respiration and circulation of that oxygen and the B vitamins and the nutrients that are involved in getting energy out of our food. And the B vitamins, of course, are lost in the refining of rice too. It's where many of those B vitamin deficiency were discovered. So we saw at the same time as that beginning of losing the nutrients and just getting the sugar and the carbohydrates refined in the diet, we also saw the beginning of mandatory education, of government imposed education, where now the bulk of the population as children are now sitting in a contained space, looking at near point tasks like reading Japanese, where there's 1,000 different characters you need to discriminate, so it's very intense visually. And we're seeing that even increase now in the last decade, with the increase of cell phones and tablets and computer use, and students no longer getting playground breaks in many schools. There's more and more hours that are spent looking at near point tasks, we call it, at computer screens of various sorts and paperwork. And the computers are twice as stressful, on the eyes compared to traditional old school paperwork and book work. So even the lack of light, we're finding, is a critical factor, that we don't realize it when we go outdoors and indoors, that there's such a difference in the exposure of our visual system to the level of light. But it's literally 100 times more light outdoors. Even, good indoor lighting, we can see because our eyes adapt, we adjust. So we don't notice that difference. We can adapt to a millionfold difference of lighting, but it is a key factor. And man-made lighting is not the same. It's not a full spectrum lighting. There are differences in the frequencies. There's flickering lights that are on and off, and that flicker uses up more vitamin A in the eye. So we're, I think, suffering from nature deficiency. Sort of the bottom line, we need to get back to a more whole food diet, a more wholesome life. Children need to interact with all of their senses and movement through a diverse environment of diverse stimuli. Interactive is a really critical component. There was research, Nobel Prize winning research with cats on vision decades ago that showed that a cat, they hook up two cats to a harness, and one would actively move through the environment, interact with their visual stimuli, and the other would be shown the same exact visual stimulus. So the image on the retina was identical, but they didn't have the sensory motor feedback loop to to complete that learning cycle of, if I do this, then I see that. So they're just seeing or being shown the same images. The cats that didn't have that active participation, even though they had the same exact visual image on the retina, they were functionally blind. They could not function. When they were taken out of the harness, they'd bump into things. They didn't have the same understanding. So we need that multisensory integrative experience, especially when our nervous system is still developing as children. So if we looked at the time, looked at different cultures, and where you even cross a border at that time, say between the United States and Mexico, and there were differences in refined sugar intake, huge differences. And of course, the American way is spread around the world tremendously. So these are no longer really confined problems, but we could see it at that time. There was literally one study found about a 350-fold, not percent, 350-fold, so whatever that is, 35,000% increase in myopia with the refined sugar intake. So that's a really key thing. And how does that happen? Well, one of the things it does, sugar is an acid forming. It's acidifying of the tissues. And that pulls calcium from the connective tissue, the matrix that holds the eye in its proper shape. So for nearsightedness, farsightedness, astigmatism, those are key factors. But of course, if we look at the degenerative eye diseases, take cataract, sugar is also a really, really key factor. Something like 35%, about a third of cataract formation can be directly linked to sugar, and that not just refined sugar, but dairy, milk sugar. There's many, many people, especially Asian and African descent, that don't handle that, that have lactose intolerance. But even if you're European descent, avoiding, one of the things that we did in our study 30 years ago that showed improvement generally was avoiding dairy, especially cow dairy that's hard to digest, large proteins that are hard to break down. So it's multifactorial. It's seems complex, but actually, it gets fairly simple if you look at the bottom line, that really it's about eating more like our ancestors did, not even in the last 10,000 years, but, going back beyond that, because our genetics, our DNA does not change all that rapidly. We're not so well adapted to eating grains that we've only, as a species, been only eating for about 10,000 years.
Okay.
Or, like our traditional diets of small amounts of animal protein, like the Price-Pottinger Foundation teaches. Weston Price was a dentist who went around the world, who saw the teeth were very healthy until people started eating refined foods, similar to what we see with eye health as well.
Yeah, it's amazing how it all really plays in together. And one thing I'll notice too, I'll mention before we kind of move away from the eyes, is that the thickness of the glasses. What I did is had my prescription reduced so I could try some of the methods of improving my eyes. And what I really noticed was how much stress started releasing from my eyes when I reduced that prescription. And
yes,
it's remarkable. Can you maybe explain what that is?
Absolutely. I mean, when I was doing that part of the work, I'm retired from the routine optometry, but when I was doing eye exams for 30 years, to me, the end point of what is the best prescription was a whole different. I had added a whole new set of questions that relates to what you're saying, because do we want the maximum visual acuity prescription, which is really what we were taught in school, make it as sharp and clear as possible? We're correcting the problem, which is the blur. But what if that blur at distance is an adaptation for information processing efficiency at near, where we're doing most of our information processing? Unless you're a truck driver looking at the road all the time, or a farmer looking, and those people tend not to develop nearsightedness. It's students who develop nearsightedness, and the better student they are, the more nearsightedness they develop. And then we go and we say, we're going to correct the problem. The problem is you're adapted to your work. We're going to remove your adaptation. Now you readapt and become more nearsighted because you're wearing that lens all the time, as though it's, it's the crutch that we've kind of, sewn into the body. We adapt our structure to that. So yeah, I would ask, well, how does your eye feel? How do your eyes feel when I change this lens? Instead of better one or two, I'd also ask, which is more comfortable, one or two. And I'd find that generally, you know, say a legal driving prescription might be 20/40 in most states. So if we'd able to back the prescription down to somewhere between 20/20 and 20/40 that was the most comfortable, we'd get a more stable prescription that was less likely for the person to come back in 6 months or a year or year and a half or 2 years and say it doesn't, you know, the power's gone out of them. You know, I need to tune up the glasses. Well, it's because we've stressed your eyes all the time, and they're readapting to reduce the stress on you. So that question of what's more efficient for the body and for the mind, what reduces stress, overall stress, is a really key factor. If we look at, you know, young students maybe who don't need glasses in a conventional sense, they see 20/20, they function perfectly fine. We find that on average, most of them will function best with a slight plus or positive lens power, we call it +50, half a diopter. Technical, but behavioral optometrists know what I'm talking about. If you use that slight, it's like a homeopathic lens. It's the opposite power of what you have as a nearsighted person, and we call it a stress-relieving lens. And we find that with that stress-relieving lens, and it can vary from one person to another, but there's this tendency to really line up at that half diopter level, which is like how much you'd want to back your prescription off. Plus or minus about a half diopter is a good amount to keep you in that legal driving range, but give you room for improvement, so that it's not here. We've corrected all the blur, so now it's perfectly clear. And if you get any more nearsighted, it'll get blurry. If you get any less nearsighted, you'll just have to work harder to maintain your nearsightedness because we haven't left you any room to improve. You know, it's like you're backed into a corner.
Well, tell us how you moved kind of from traditional optometry, or even your brand of optometry, and you've kind of expanded into a whole much broader thing, right? So tell us about that.
Yeah, the question reminds me actually of the first patient that you know took me, you know, well beyond where I knew I wasn't in Kansas anymore. This was back in New York, but one of my patients who I'd worked with cataract had such improvement not only in his vision but also in his prostate symptoms, and had talked to his neighbor over the back fence about what he was experiencing, how much better his prostate was working. And the neighbor had a prostate problem, didn't have cataract, but wound up being referred to me to asking me, well, can you help me? You helped my neighbor so much, can you help me? I said, well, I don't know. It's not in my license to help that particular issue. But then I didn't do anything for him that I couldn't do for anybody. There was nothing licensed about, changing your diet, avoiding a few things, taking a few supplements, being aware of some risk factors. And we find out, since then, there's a couple of key remedies that we use that help both prostate and cataract. So there's some kind of correlation, some kind of resonance and relationship there. We know from European biological medicine that they talk about different parts of the eye having a resonance with other meridians and other systems in the body. So really, the eye is, if you look at the meridian maps even in acupuncture, a lot of those meridians come right to the eye or from the eye. And others that don't do so on the surface, like the liver meridian, comes to the eye from the inside of the body. So it's my theory that the eye is like the photovoltaic cell. It's the solar direct current battery for the brain liver battery, which is, we know from some other research that came out of early optometry with light therapy, doctors doing light therapy back in the 1930s. They were researching and found that the brain and the liver had the strongest electrical dipole, the strongest battery, direct current battery effect in the body of major organs. Well, we know now that the retina of the eye is the main source of that electrical power for the brain. In fact, 2/3 of all the nerve current, the electrical current going into the brain from all of our senses, comes from the two optic nerves.
Wow.
Yeah, it's just, so to me, it's always been fascinating. I come from a science background, trained at Dartmouth in many sciences, and with this background in my family and holistic health, I'm always looking at the bigger picture. I wanted to go into nutritional medicine, but back in the 1970s, that was like a war zone. You'd be fighting your whole profession to try to do any kind of nutritional treatment. Now fortunately, things are slowly changing, but even today in some places, there's a lot of a lot of pushback from the pharmaceutical based healing industry. Which is very sad, because pharmaceuticals that never existed in our genetic history there's no scientific theoretical basis to think that that's actually healing or could be healing. We'd be hitting the jackpot if we found a drug, a new chemical that never existed, that's actually adapted and suited for our genetic being to actually use in a way that's balanced and healing. So yes, they're strong, powerful chemicals, and they can manipulate and change how we feel and our symptoms, but typically at the cost of our health.
Exactly.
We've seen several times around the globe, including in California and Israel, South America, other places, that when the whole medical system goes on strike, the death rate actually goes down. And we've seen it in other ways. In New Zealand, there was an asthma medicine that they were concerned about for public health because of some of the side effects. And so the government planned to take it off the market. Well, the doctors were really concerned. The patients were up in arms saying, this is one of our main drugs for controlling asthma, and we're afraid the death rate's going to go way up if we don't have access to it. What are we going to do? Well, the government went through one of the few times, government action actually was good. Turns out, despite, the pressure from the people and medicine to no, leave us our drugs. And they took it off the market, and the death rate went down. Nobody expected that. This was not a placebo effect.
No, that's not. That's stories like that. Yeah, you hear in the things like I guess there was a brownout or something in New York, and the hospitals couldn't do anything, and say the fewer people died. I remember.
Yeah.
So yeah, that's really, everything ties together. And then, I think, like you mentioned, nutrition is slowly, at least even McDonald's now is pretending to have nutritious foods and salads and things. So
the reason is the people are demanding it. As in public health studies, you find out that the way that medical practice improves, the way that health improves, is people get educated and they vote with their feet. They go to a healthier place, and so the place that isn't so healthy, like McDonald's, has to change their tune to try to keep their business. But they're losing. They are losing money. They're losing business, and there's a good reason for that.
Yeah, I even remember going with my dad a few months ago, and he wanted to go to Captain D's. I'm like, Captain D's, but they had a healthy for them meal, broiled fish with broccoli and salad, so even what we would consider the greasy spoon sort of fast food people are seeing a demand. So it's encouraging, because that's, we're maybe 20 years behind that in the world of energy techniques and mind-body stuff, but it's starting to move in the same direction.
Yeah, it is changing. There's more and more people seeking out alternative therapies, more and more people questioning, even if they get a Western diagnosis, how am I going to treat this now? Just because I have whatever the disease is, I've got a name, a label for the symptoms, but do I trust that drugs or surgery are the only way to treat that? And do I think that is a surgery that removes the organ going to remove the cause? We know that cancer doesn't just exist in the tumor. It's in the blood. It's in the whole body. It's in the immune system. It's in the psyche. We have to work on all of those levels, and preferably in a way that does not break the first law of healing, of first do no harm. Every physician still takes an oath to first do no harm. That's how we heal, is by not harming the body, not getting in the way of the healing, but actually supporting and identifying what are the factors that this person, that this body, that this eyeball will accept and use in an efficient way to improve the quality and speed and ease of its healing process. Because our bodies are always healing. We wouldn't be here if we weren't always on the mend. Every night we sleep, we're detoxifying, we're repairing, and we're doing it during the daytime too. And we're also exposed to stresses. And our mental, emotional, psycho-emotional stresses are a key are half of that. Literally, if we measure the toxins in the human tissues, we find half are the breakdown products of our stress responses. So working at the level of the psyche, which vision is our dominant part of that as human beings, and so that's one way to work with that, is through vision therapy with optometrists, color therapy called syntonic optometry with optometrists and other color therapists that are trained in that. There's there's many ways. I'm not going to say that those are the only ways, but they are powerful ways that I've experienced and how I got started. and from there just looking at, well, what else? Can we do heart math biofeedback to reduce stress? Yes. Can we do, there's systems, NES, you're going to hear about from other speakers during this symposium, a system called NES. It's wonderful. We've brought that on. Another one called Cyto, where we work with a lot of clients remotely over the internet. And, more and more people are wanting to do their healing work at home, which is, the most comfortable environment to heal. Do you want to be in the hospital? It's like, no. 1 out of 3 people come out of the hospital with a new disease, whether it's a nosocomial infection, which are the worst infections, most resistant to antibiotics, or whether it's iatrogenic disease caused by, medical error or side effect of medical treatment. These are not, not benefits. How much healthier do we get by having health insurance, or by, saying yes to any of the treatments that are covered by insurance? I gave up my health insurance almost 30 years ago in order to heal myself. I said, I'm going to put that money into actually doing naturopathic care, getting more of the treatments and access to the knowledge and the remedies that I think will actually work at a causal level to help me heal. I was supposed to be dead 20 years ago from heavy metal toxicity. Wow. So knock on something wood. Here I am, getting healthier and more functional, being able to write books and make videos and learn all kinds of new tricks on the computer, at age 60 and feeling pretty good. So that's, hopefully an inspiration for people out there who may have some kind of a diagnosis. That I was told when I was 25 I'd be blind before I was 50, and then at 30 I was thought I was going to be dead before I was 40. We don't have to accept the prediction of what we are facing as a death sentence, because we don't have to follow the traditional, the conventional medical approach to treating that. It's just a prediction. If you do what everybody else in our culture is doing, this is what you're looking forward to. If you try something new, you may get a different result.
It's a huge thing. And one thing I learned recently talking about hospitals, and this was from a lady who was just like an orderly or a former Army medic, told me that one of the big problems is that when patients come in there and keep taking their normal prescriptions, just the fact that they're laying up in the bed and they're not moving, it builds up in the liver. And she said they have a lot of them actually die from their normal prescriptions because they just don't process them through the liver.
If you put together all of the medically related causes of death, there's many who have looked at that and say that's actually the #1 cause of death. Is how we treat our health, is how we wind up with disease. The average American now gets over a dozen prescriptions a year.
Yeah,
and there's no studies prior to approving those new drugs of how they're going to interact with each other. So it's a chemistry experiment in the human body, and the liver is the crossroads for that. We know that in cancer, cancer doesn't kill many people. People, yes, it's a big problem. It's a huge problem. It's a problem with our immunity and our ability to heal that. But what cancer patients actually die of is rarely the cancer. It's most often either liver failure, as you're saying, kidney failure, and those are our 2 filters to clean the blood, so detoxification problems, or malnutrition. So not enough of what we need or too much of what we don't need. Those are the 2 ways to get healthier. Clean out the bad stuff, bring in some good, juice fasting or whatever the approach is. Find a practitioner that you feel aligned with, you feel comfortable with, or a team of practitioners. Some of our best clients are like, a medical doctor who's been dealing with like her 3rd, 4th round of cancer now, but she does well with each round, and she's her own doctor, but she goes to a medical center that uses naturopaths on their staff, and she's got her homeopath, and she's got us doing energy and information medicine at a distance and plugging in the gaps, and she appreciates each one of those, and putting together her therapy and her protocol. So cancer is not a death sentence anymore, and that's really the thing that we're most afraid of. Certainly cardiovascular disease is the other big killer, and that's way preventable, but not if you wait until you have the heart attack or the stroke. I mean, yes, you can do prevention, and most people will start doing prevention at that point, but an ounce of prevention is worth a pound of cure.
Absolutely, and it's just really the little things. Even if you can just, there's a few major things. Maybe talk about some of the pretty major things that if we could take out of our diets, or just what do you think, or maybe 5 or 10 steps people could do that would be pretty easy.
Yeah, there's some really neat and powerful things. You know, one of the ways that we lose a lot of our nutrition is, besides refined food. I mean, let's say first thing you can do is stop shopping the aisles of the supermarket, stay on the outside, and buy organic, because, you know, one of the big problems is pesticides in the foods, the GMOs that make their own pesticides, and they're able to put more pesticides on the crops, and now they're harvesting crops by putting pesticides on them to make them die when they want it to die. It's like, this is Frankenfoods. So real foods, things like for eye health, collards and kale come up, and for general health, come up the top of the list for the healthiest foods. They're like at a rating of 1,000, and the next, you know, best food is a couple hundred, and then most foods are under 100. So eating lots of greens, and especially those dark green, not lettuce, you know, not iceberg lettuce. That's whiter than green, more white than green. It doesn't have much in it. But kale and collards are tremendously powerful foods. Of course, you want them to be organic, and generally, you know, if you can get baby kale or something and tolerate that, raw foods are great. You're getting enzymes. We need raw foods. If you're cooking happens to be one of the other ways that we destroy a lot of the nutrition and remove a lot of the nutrition from our foods. So rather than steaming that kale and collards to death, and at which the heat breaks down the B vitamins, they're heat labile, they're water soluble, so they're pulled out into the water, and now we throw away the water that has the nutrition in it and eat what's left of the nutrients in the food. You know, for people who may say, oh, I can't afford organic food, it's like, well, guess what? If you can afford the organic food if you get the nutrients from it. If you look at the cost per nutrient value, you can't afford not to have organic food, and you can't afford to be, you know, steaming it and throwing away the water, or boiling it and throwing away the water. So low temperature, there's cooking processes we need to update our lifestyles and understand, and they're just so much better. There's more flavor in the food, there's more nutrition in the food, but it's low temperature, cooked in steam rather than oxygen, because oxygen oxidizes, it breaks down many of the nutrients, and pretty much waterless, oilless cooking. So it's energy efficient cooking as well. It's a little investment in the hardware to do that. There's a number of companies that sell that kind of cookware, some more expensive than others, so you want to shop around. But that's a tremendous boost to the efficiency. It's going to save you money on cooking by using less energy in the long run, and save you a ton of money on getting the nutrients that you need. Our soils today are so depleted in nutrients. We need not only organic food, but we need to understand that there's a difference between just organically grown versus nutrient-rich food. So we want food that is grown by, know your farmer. Get it from a local farmer who is really into building the soil. You know, there's an interesting story from Europe when Chernobyl happened. There was one farm in the area that was hit by the fallout where they found no trace of radiation in the food. All the other food and the topsoil, and it had to be bulldozed and buried as toxic waste, radioactive waste. This farm was being run by a couple, a husband and wife, that were retired professors of bacteriology. They were looking at soil science and building the bacterial culture of the soil, the living soil. So that's a clue. Those were healthy plants. They were able to, I don't know if they were transmuting those elements or just able to detoxify and eliminate them. There is much evidence of biological transmutation in biological systems where we can take one element and change it into another. That could be a whole other talk. But it's fascinating. We should be open to the possibilities for healing, because there's a lot we don't know, and what we've learned, up to this point in our conventional theories and models of science fail to explain many observations, like biological transmutation. That Professor Caravran wrote his book probably 40 years ago now or more, and on all the research that shows, if you fed chickens magnesium but no calcium. They continued to lay eggs and didn't lose their bones. They're obviously making that magnesium into calcium. There's no other alternative except for magic. Magic is just the science that we don't understand yet.
That's right.
Or miracles. Miracles are real. Miracles of healing happen, and that comes with, you know, acceptance of the mind of greater source energy and truth and you know, spirituality. That's part of healing. People who heal themselves of cancer, long-term survivors, they almost without exception look back at the diagnosis of cancer as the turning point that improved their life. So it was a godsend. It was a gift. So again, healing is not for sissies, just like aging.
Right.
It's a whole person event. You want your body, mind, and spirit involved, and then it becomes life itself, and of tremendous value.
Yeah, it's like everything, like you're saying, everything in life really reinforces a greater learning and understanding. It all really works the same way in a sense.
Yeah.
Even though
it becomes an adventure and a wonderful thing. You know, even then having a symptom, I've been through with my own history, and I've been through many healing crises, getting heavy metals out of my body, being flat on my back for a month, high fevers, you name it, and all kinds of diagnoses along the way. But when you look at it as a dynamic process rather than, oh, I have this thing, you know, now mentally I'm taking on this construct of disease and I have this thing and, oh, I'm always going to have it because that's the Western view. And now I'm finding drugs that can kind of suppress the symptoms and keep it there. And we're just building on that heaviness, that weight that we're carrying, versus let's go through it. I had seizures, grand mal seizures for a period of time when I was getting heavy metals out of my brain. For years, before that, I was not reading. I was not writing anymore. I was, you know, we have a farm out in the jungle here. I was working on getting myself healthier by being physically active in nature, and that helped. And when I finally, you know, completed the heavy metal detox, you know, I'm back in the intellectual world and writing books and all that. So we can overcome these things, and spiritually, that's why we're here. It's our spiritual gifts are the flip side of the challenges that we face.
Yeah. Not
the ones we run away from or suppress. Those don't count.
Yeah, that's true. I mean, everything really is a lesson, and that usually we don't learn it very quickly. But it's quite true. And we do have actually in this whole Living Energy Day, we've got so many things that tie in together, and I think that's really the beauty of this. Is some of the people I've had just a brief interaction with so far, how much it ties into just what you've talked about so far. So this is going to be a really great event here, and because we've got somebody coming up later tonight that's going to talk about detoxing heavy metals, and that was perfect.
Yeah, so important.
Healing, you know? So
important for every chronic health issue. The heavy metals need to be out of the way. We need to get ourselves out of harm's way as far as really powerful electromagnetic fields. Clear our environment of some of these technological frequencies that are not selected for our health. Some of them may be neutral, some may be beneficial even. There's rife frequencies, many different frequency therapies where we can choose frequencies that are healing. But the ones that are chosen for cell phones and Wi-Fi and 50 and 60 hertz power mains, these were not selected for our health. And for example, the 50 and 60 hertz that's everywhere, depending what country you're in, they block circulation, they block immune function. There was some great research that started coming out of PhDs in Taiwan. The moment that they came up with the answers and were ready to publish, they lost their funding, they lost their ability to get any funding for any kind of research because it was inconvenient for the powers that be that, no, we'd have to change our electrical system. But imagine if we did. Imagine if we changed our electrical distribution system to a beneficial frequency. And I propose 172 hertz. It's a frequency that I found in my own exploratory research. I was looking for a beneficial frequency for a particular thing for the spirit minerals that make up the conscious body, what we call ormus. Most commonly, there's other terms. Bose-Einstein condensates of the transition minerals that make up the spirit body, our immortal conscious body. What could be more important than that? Looking for a frequency that would attract them, and found it just exploring one frequency after another. It's like, wow, something's happening here. There it is. And then I found in looking for any corroboration, I found a reference to ancient China and Tibet, that this was the frequency that for 1,000 years was their metric standard. It was what they called what's the name? 172 hertz was the dominant harmonic frequency of nature. And so it was the most highly valued thing in the entire empire of China, the middle country, and all the way out to Tibet. More highly valued than the emperor, because the emperor will eventually die and you have a new emperor. But this you protect with everything, even beyond the emperor. You can replace the emperor, but not that 172 hertz standard. And so every year they'd make multiple copies to resonate with it, tune it, finally tune it, and send one out to each province. And this was also known as 1,000 years of peace. So when I read that, I was like, okay, I couldn't ask for a better support for my observation. Like, let's try using that. We'd like to develop systems to cook with that, with the kind of cooking systems that I was talking about, with magnetic induction cooking, which is very efficient. But right now we're using 50 or 60 hertz, which is a frequency that we know drives off the spirit minerals. So we're still retaining the nutrition, the conventional nutrition of vitamins and minerals, but let's also concentrate the alchemy of creating a healing environment in the kitchen, and healing environment in the food that becomes a sanctuary for the nutrition for the conscious body. The consciousness ultimately is why we're here, and it's why healing is important. What good is it if we heal the body, but the spirit is destroyed? What value is it if we can dull pain, but we also suppress consciousness? We don't even know. And in our Western conventional view, we don't care. Who cares? We're treating the pain, give them opiates, they're going to die anyway, let them be unconscious. I had a patient come to the Big Island to pass with his daughter. He knew he was dying of metastatic cancer. The doctors gave him 6 weeks to live. He was already on opiates, pain breaking through despite the medication. She put him on a juice fasting. We tested energetically how we do and gave him support with a few remedies. And in 6 weeks that he was supposed to be dead, she had him off of the opiates and pain-free. He lived for 6 months. He was still going to die. He was, his liver and colon and lung were all filled with cancer. But he died without pain. He died consciously, didn't have to take any opiates. The day he died, he was so conscious, in the progression of his spirit, he knew that was the day. And he asked his daughter and son-in-law to stay home with him, and they got to say conscious goodbye. I mean, to me, that's successful healing. We all pass from this biological body, but let's have a quality of life while we're here. And the other beauty is, if we're going to extend life, like in his case, extend it from 6 weeks to 6 months, but with increased quality. And that's what we see in the epidemiology, that people who live longer generally have fewer years, less time that they suffer. So we want to increase longevity, increase quality of life. There's no trade-off. There's no reason not to heal ourselves. It's like the t-shirt, my favorite t-shirt, that says, if I knew I was going to live this long, I would have taken better care of myself.
Right. Yeah, and there was a story too I heard from a local guy near Nashville, Tennessee, which is not too far from where I live, and he was a sound healing guy, and he went to Mexico a lot in Central America and dealt with the shamans and the medicine men. And one of them had claimed to be, I guess, the Don Juan of the Castaneda work, which I'm not sure if they weren't sure if he was the real one, but one of the things he mentioned that were really bad about Western medicine was the opiates that they gave people at the end of life. That was, to him, this medicine man said, this is a horrific thing. That really, like you're talking about, they saw that as just a very evil thing almost in their way of looking at things. And how
it's not healing. I mean, yes, there can be a time to use that to ease suffering, and it should be at the choice of the person who's suffering. But it doesn't solve the problem. It's just killing the messenger.
Yeah, and I see that a lot. I work with some light therapy devices you'll be learning about too on the week, and you've experienced it. I've shared it with you. Yep. But I see people walking out of these pain clinics, and the poor things are barely moving, and it's just thinking, there's so much out there a whole world of things, and they're just on this one little track and it's a crisis. It's really become a crisis, and even the doctors are aware of it, that they don't know what to do, with all the drugs.
Yeah.
So any final thoughts? We got 3 or 4 minutes, Glenn. So what would you like to wrap up with as a good encapsulating thought here?
Well, so I've been really fascinated myself with understanding all this, understanding the kinds of remarkable healings that we'll see sometimes with energy medicine. So I've been working on what I call the clinical theory of everything, to understand, to be able to, if we can model, if we can explain, using our understanding from science and drawing together so much of the science, it takes decades, it takes a whole generation to be able to integrate it into medical practice. So I've been working on that, coming up with what I feel are the explanatory ideas, and it's been working out really well. Every time I come up with a new question, I go to the model and say, well, what would the model predict? And I make my prediction. Then I go to look at the actual, what's out there in the scientific research to see, well, what do we know so far? And it'll line right up with it. It says, yeah, well, that fits. It fits. It's not how they're looking at it, but like this 172 hertz frequency for the conscious body, I looked at it and I said, well, I couldn't find objectively or in my own frequency research, I couldn't identify an effect at other harmonics of that. I was looking, I thought, well, but theoretically there should be some effect at, at least at octaves. So I looked at, well, what's half of that? Like, 86 hertz. I said, well, what's going on at 86 hertz? And had to look for a while and finally found, oh, that's the center. That's like the precise center of the spectrum of the movement of the eyes. If we do eye vision research, if we use a special mirrored contact lens, we can stabilize the image on the retina. We don't realize it that our eyes are moving, but if you're looking at the center of my eye, you feel like your eye is stationary, but it's actually moving, a microsaccadic movement, a tiny, tiny back and forth movement. And if we stabilize that, either with like curare in the muscle or these contact lenses, it's a lot easier on the patient in research, then you are blind instantly. So wow. It's a movement that's essential for vision that's at an exact harmonic octave of that 172 hertz of the minerals that are the carrier of vision. And these minerals operate in a whole different way than what we're used to thinking with minerals. They move according to thought. We can guide them with thought. Like, why is thought so powerful that we have to do double-blind, placebo-controlled experiments to even find out if some powerful toxic chemical works or not? It's essential because the power of the mind and thought and consciousness is equally as powerful as all the standard chemistry. Just like when the cosmologists look out in the cosmos and say, well, the way we're looking at it, and I can tell you where I think they're going wrong, and I do that in my model, but they say, we think we are seeing 4% of what's here. There must be another 96% of dark matter and dark energy that we don't understand, and I agree. And I think even their understanding of their lack of understanding is a misunderstanding. They're looking in the wrong place. I can go into why and where we need to look and who is looking in those directions, because there are people, just like in medicine, there's alternative holistic doctors like you'll be hearing from in the course of the next 2 days. There are people who are outside the box, thinking on our own, saying, wait a minute, no, that doesn't explain all these other findings. Kind of like, another favorite story is in Australia, when they were measuring the ozone layer for many years, every summer, they'd throw out the data because there'd be zero on the measurement. They'd scratch their heads and say, the equipment's malfunctioning. Okay, it's outside the bell curve of measurement. In our theory of how measurements work, like, that's just wrong. It must be measurement error, throw it away. And until somebody realized, well, didn't that happen last year? And they look back at previous years, and it was every year, and they realized, oh, there's actually is a hole in the ozone layer, and it's seasonal, and it moves. It's like, oh, it's kind of like the natives in South America are said to not have been able to see the European ships when they came in. There's something out there at the reef. No, there's not. I don't see any. There's nothing there, because it doesn't look like anything we've ever seen or expect to see. When we see, we're not just seeing what's there. By the time we see it, it's a combination of what's coming in the light patterns, and what we are looking for and expecting and what we've seen before. And so it was first the shamans who could see, oh, I think it's a tree. There's like a tree out. And then, you know, slowly the other people could start to see it once the shamans saw it. So realizing the nature of our consciousness, we have to expand the consciousness. Like Einstein said, we're not going to solve these problems that we've created at the same level of consciousness that created the problems.
Exactly.
The cultural thinking that created the stressful environments and the physical stresses, the mental emotional stresses, the nutritional stresses, the toxic stresses, that's not the level of thinking that's going to get us out of this mess.
No, it's people like you that are really tying these things together. So why don't you tell everybody where to find you, with your website, or the best way to reach you so they can do further study. I certainly will be doing more.
Yeah, very happy to share. So I'm working on about a dozen different websites, but they're in process. So please be patient. It's like healing; it's a work in progress. The main one where we've got a lot of things up is at tryunity.net. So it's TRY Unity UNITY.net.
Okay, well check that out. I think Glenn has actually given away some of his books on there too, if I saw her.
Yes, absolutely. And if you have any challenge with figuring out how to do that, just find a spot there to write to me, and we'll help. Okay,
well that's wonderful, Glenn. It's so great to have you with us, and I really look forward to more. I got some more stuff I want to talk to you about for sure on this whole consciousness thing. And the 172 hertz is fascinating. So I hate to cut it off, but we've got to move our next folks on. And I think they were asking some questions too. They might pop in for a minute and ask you a question off the record here. I'm going to stop the recording. So thanks again, everyone. Glen, Dr. Glen, or Glen Swartwout at tryunity.net. And we look forward to hearing more from him. So thanks again, Glenn.
Aloha, as we